healthcare. A mistake and somebody dies. It's not like manufacturing. Because seriously, if you digitalize rubbish, you will get rubbish.
What tips do you have for those types of people that are hoping that, one day they can apply to a scholarship at Oxford as well? That can change their life.
Applying for scholarships and actually getting them, it's more about...
what are some tips that you would give to, of course, female or other female professionals on how to navigate the workplace and how they can excel as well, even while, facing all these barriers?
But I would say that you should optimize for where you can get your hands dirty. Do the real work on the ground. Build the skills that you need to build early enough so that as you progress, you'll be able to say, I have done this thing, been there, done that.
It's been good enough.
Being good enough is not enough, as we've been saying. The visibility is important, especially in this era. You can't just sit in the back seat and you're doing great work and nobody knows about it. Nobody knows about you.
How doctors can be better treated in terms of financial remuneration, in terms of, the conditions of work.
It is really difficult and also difficult to solve.
Do you really see AI basically replacing doctors, replacing, nurses in the near future? Thank you for joining us on another episode of the BIIG Africa Podcast. And today I bring you an amazing guest, Dr. Ngwashi Christabel. Dr. Christabel is an Oxford-trained medical professional who rose from the ranks, from the trenches in Cameroon, working as a medical professional and now works for the World Bank in Washington. Thank you for joining us, Dr. Christabel.
Thank you very much, Baba. It's such a pleasure to be on BIIG Africa Podcast. I've watched previous episodes and I'm like, okay, I need to be on this as well.
One word that I keep in mind when I think about you is ambitious. Yeah. I don't know why that word, but it's just someone who is driven, someone who achieves a lot. And I think me and you we've had the history of talking a lot about, doing things. And it's such a long journey from where you started till now. So what makes you ambitious?
I would say what makes me ambitious is the problems that I want to solve. Really, the problems that keep me up at night. Because I think stemming from when I was a child, I was down with a bout of malaria, and that kept me in the hospital for a long time until I had to miss my exams. And I was so amazed when I had a doctor come into the hospital, give a few infusions, some tablets, and then the next day I was up and running, and I told my mom I would want to be like that doctor. So growing up, I realized that the problem that I want to solve actually, that's bringing good health to people, ensuring that people are at that best state of health to do what they want to do to contribute to society and all of that. I realized it was way beyond just this one-way doctor-patient relationship. That's a really important thing, but I realized that was really a small part of the solution that I wanted to bring. So when I started thinking of it more like this is a systemic issue and I want to solve systems, that's how my ambition started changing over time. So it started really from, I want to be a doctor so that I can bring health to people. I went to medical school and I realized, okay, now I've started treating patients, but I realized as you treat patients, there are other factors that actually contributes to the illness that brings them to the hospital: environmental, cultural, and systemic issues. And therefore my ambition improved again and said, okay, I have to go beyond the individual care of patients and then to look at it more systematically. And that's how my ambition has grown. So I would say what is driving my ambition is really the problems that you want to solve or the problems I want to solve. And maybe that's how other people could look at it.
So if we broaden that out to the wider context, me and you are Cameroonians and we grew up in that community. I think from my angle, I always look at it like maybe there's a bit of a lack of ambition in certain people, in certain, way of doing things. Do you also see that? And do you think, being ambitious, having big goals that you want to achieve is something that especially young people need to be putting all their minds on?
Absolutely. It can be tempting that being born or raised in Cameroon, it can limit what you dream to become because of the environment that you find yourself in. Because, people usually say you can only grow to the size of the environment that you are raised in or which you envisage. Because you can be in Cameroon and still maybe through movies or travel, you're able to see the bigger picture. But for those who don't have that advantage or leverage to be able to see beyond Cameroon, it can actually compromise to what extent your mind can envision where you can go or what you can do. So it's important that youth, especially in Cameroon, do not let that environment limit what you can do or what you can dream to do. And you can start broadening your vision or building that ambition through books, travel, and now the internet. There's a lot of information online. You watch movies, you watch documentaries, and you listen to podcasts like this one where people come to share their experiences, and you're able to say that, okay, if this person who was born, raised in Cameroon is able to go here, I can also get there and even further, So it's important for we as Cameroonians not to let our environment, especially also where culturally in Cameroon, everyone tells you to wait for your turn. When you look at leaders, they're in like 60s, their 70s, and it starts changing what success means like to you. You start feeling, okay, as a young person, I can't make it. I have to get to like 50, 60, 70 to be able to get to a position. But then you see other children or other people, other youths, for example, in other countries doing big things. And you're like, oh, we can't do that because we're in Cameroon. Don't let Cameroon be your excuse or let your environment be your excuse to why you can't be ambitious or you can have a vision beyond what your environment currently provides for you.
That's so true. And I think even looking back at my own story, I'm a Cameroonian. I grew up in a very small town.
Yeah.
And what you talked about, watching movies that, broaden your mind,
right.
Having the internet where, you're able to look at this. Shout out to Google.
Yep.
And, having those things that really put you out there. You can be in a small town, you can sit in Yaoundé or in Douala or in Buea, but your mind is at the top of the world. You're sipping in all this knowledge. I think that is definitely so important.
Yeah, and that's one thing I would say. I'm really grateful to my parents. That's one thing. Yeah, I mean, shout out to all the parents who would broaden the worldview of their children. My father really made us to be able to read books beyond what we learn in school. To read books. Even though we couldn't maybe afford trips out of the country, but whenever he travels to maybe Douala or to any trip he takes for business or anything of that sort, he would buy books for us to be able to see. And because I was one of the children who really loved reading, he really made sure that he made the resource available. And so that's one thing that I would really recommend as well for parents to start bringing up in the children quite early. And this is really backed by science. In fact, the Human Capital Report that was just published by the World Bank, I think last month, it actually showed all of these statistics. Children who read, parents who made reading a non-negotiable at home had a higher human capital index. That means they had a higher earning potential when they were older compared to children who didn't read as much. So any investment compounds, be it financially, emotionally, or mentally. When you start building that mental view in children to say that, hey, it's not just what you see that is available to you, or it's not just what you see that is achievable. You can achieve more than what you currently see if you're able to build the capabilities that you can sell to the world.
You're a medical doctor, trained in Cameroon.
Yeah.
Shout out to the government of Cameroon. And you're also a graduate of the University of Oxford, where you did your master's degree.
Yeah.
Such a great institution as well. Education, right? I think that really speaks to the power of education for you to be where you are today. Would you say that education, as it is, or what you've been able to go through, is really the bedrock of your current success?
Absolutely. Any day, any time, I would say that. Because, for you to be valuable to the world, you need to ensure that you're able to give value that is not just valuable for Cameroon, but to the world at large. And coming back to what I said about being able to bring about systemic change, because healthcare is universal, and my mission is to ensure that everyone everywhere has healthcare of the highest quality at the time that they need it, with the least financial, burden on them. So that's the mission I'm driving towards. And I think every health system across the world is also driving towards that vision to ensure that they're able to provide healthcare of the highest quality to their citizens at the time that they need it with the least financial burden. And therefore, knowing that that is what I want to bring about, I saw that, okay, how do I ensure that what I have gained in Cameroon as a medical doctor or the medical skills that I have gained, because of course, in medical school, diseases are also different across different regions. Tropical diseases may be different from temperate diseases. For example, malaria is not a lot in America, for example. And so our medical education, of course, they're training us to work in Cameroon. Every country trains their doctors to work in their country. So our medical education was somehow targeted towards the problems of Cameroon and since Cameroon is in the tropics, plus tropical diseases. Yeah. But then I had to sit down and think of, okay, since healthcare is global, and if I want to, what happens in one health system affects another. You know what happened in COVID, you get. Yeah. So it's something that I can't just focus on Cameroon alone. I had to think of, okay, now, if I want to ensure everyone is safe and has a healthcare, I had to think bigger, not just beyond not just the Cameroon health system, but entire world, global health. And that's what pushed me into going to do a master's in international health and tropical medicine in the UK. And I would say that course totally changed how I thought about healthcare systems, because I literally had to define what is a health system. What do you define as health? What do you define as good health? And what does good health mean to different people, to different systems you get? So education is really the bedrock on which you plant first the mission that you want to achieve. This thing that I want to, this objective or this goal that I'm working towards, what is it I need to actually achieve it? The skills, the experiences, the exposure. And for you to be able to do that, you need to get educated. And I don't just mean sitting in a classroom. You can get educated on the job as well. You can get educated just by experiences, talking to people. I mean, there's so many times I've had conversations and I'm living there thinking like, okay, maybe I should actually think of this thing like this. So education in whatever form it is, be it formal in the classroom, or informal through learning or life experiences, of course, shapes the skills and the value that you're bringing towards achieving that objective, globally and also nationally, depending on what is your ambition.
And of course, just coming back to your experience at Oxford, I think you studied in the University of Oxford on scholarship, which was really amazing. And if you look at those types of opportunities, there are so many young people that don't have those types of opportunities, and every day they are hoping and praying and looking at ways that could be their lot in life. So what advice, what tips do you have for those types of people that are hoping that one day they can apply to a scholarship at Oxford as well, that can change their life and be able to get it?
Okay, this is me talking on the background, hoping that the UK government releases the ban on Cameroonians who are for student visas. So with that hope in mind, I would first say that applying for scholarships and actually getting them, it's more about strategy and I would say to some extent luck or grace or whatever you want to call it, depending if you're a Christian or anything. And it's not just about whether you think you're worthy. You may think, I've done all of these things, I've published papers, I've worked as a doctor and all of that. And the scholarship committee is going to look at it and say, okay, no, this is not the person we want to fund, right? So it takes a lot of strategy and some luck for you to be able to get through. And because this is money people are paying. I mean, whoever funded me paid over £60,000 for me to get my master's in 1 year. And so the people betting on you have to ensure that they're betting on the right person. And that person betting on you has to mean that if we're betting on this person, it means that it's going to create ripple effects. We're not just going to give you an education and then you're going to take it and use it or sit down on it without bringing the impact that we want to see. If we're putting in our $1 or £1, is to ensure that the education that we give you should be able to give us in returns about $10 or $100. I mean, not like in physical cash, but in impact. Get. So when I say strategy in scholarships is first, highlight what is the North Star or the problem, again, you want to solve. You get, if you're in health, you don't just want to go do a master's in public health because, that's the thing going on, or you want to go do a master's in AI in health. because that's where health is going. You have to justify there is a problem you're solving. And not just because there's a problem, is that problem relevant? First, to the community that you want to serve upon getting that education, and also to global health. Because most times the funders are, from the Western world, maybe Europe or America, and sometimes even your government. So depending on who is funding, you have to see, is that problem relevant to the person that I'm asking for that funding from? And if that problem is relevant, now you have to find out what's the trajectory that you have used in achieving or in solving that problem. Because they want to see that you've identified the problem and you're not just sitting and waiting to get that degree to be able to solve it. They want to see that, okay, you've taken steps. For example, one of the things I did was, okay, the problem I identified was maternal and child deaths were high. In the hospital I was working in the Southwest, which had conflict. Mothers were dying, children were dying. That's the problem. We need to solve it. And what are some of the things that you've been doing? First, maybe we were able to do like health education or ASA through text messages for mothers who could read, or for those who could not come to the hospital. Or we were able to, for example, partner with Medecins Sans Frontières at the time with their ambulance services to be able to bring women to the hospital when they needed it and all of that. So let them be able to see that that problem is actually troubling you, that you have taken steps to start solving. And then in writing that personal statement, now what I usually tell people is to use like the bridge concept, where you say, okay, based on that problem you've solved, this is where I want to go. So I want to be able to reduce maternal and child deaths in Cameroon by 50% by this time. And this is where we are now. Yeah. Now, this course or the scholarship I'm looking for has to be the bridge to take me from where I am or what I'm seeing to where I am going. And in identifying that bridge, you have to say, first, why that school? You get, like, what is it that school? Like, what is the material of the bridge? Because you can build a bridge with wood. You can build a bridge with steel. You can build it with metal. Why is that school the one to give you the skills that you need to build a solid bridge for you to go to where you want to go to? And if that school is the one that you've chosen and you're able to articulate it to the people, you're able to now tell them, upon building that bridge with the skills I will gain from this course, after you've left that course, what will you do to take steps on that bridge that you've taken? Because it's not enough for you to have studied. So you should be able to communicate, okay, upon completing this course, these are the things that I'm going to do. Maybe you can, if you have a number of words, short term, medium term, long term, this is how, so that you can take people on a journey. They can be able to visualize and say that, okay, if we put money in this person's education, we're sure that in the next 5 or 6 years, we'll be able to see maternal and child health drop in Cameroon by this percentage. You get. And from there, you can be able to convince people to put their money and bet on you for scholarships. That's why I say it's more about strategy and some luck, and then when I talk about like luck, it's something else we can talk about, but there's a whole thing around increasing your surface area for luck as you go through life. And with that luck as well, and the technical knowledge that you have and everything, you should be able to go through scholarships. And one thing I'll add is scholarships are very competitive.
For sure.
Even if you don't get it, it doesn't mean you're not smart. It doesn't mean that you're not enough. But it could also mean that the competition was so tight that they had to take the best of the best. You are still in the best pool, but they had to take the best of the best, or the one that was able to communicate best. That's why you need to try your best as much as possible to ensure that these people see you as the person that if they put their money on, they can have a ripple effect and impact.
That's true. And I think that luck aspect is very, very important. And it really boils down, for me, I think the luck is more on the angle of preparation, basically. How prepared are you for that next step? Absolutely. For example, if you're applying for a master's, you already have to have a good bachelor's degree, and you already have to have a bit of experience to show basically that I am doing this, just like you said, I'm doing this, and these are the next steps that I want to take.
Luck is when opportunity meets preparation.
Yes.
That's what I'm looking for.
Definitely.
This boils down, as you said, you have to show. That means visibility is important, especially in this era. You can't just sit in the back seat and you're doing great work and nobody knows about it. Nobody knows about you. You're great, But you would realize sooner when we talk about ambition or accelerating in your career, that is those who talk highest about what they do, get seen and get promoted. You'll be sulking, saying that, oh, this colleague who doesn't do anything, but walks around the office every day, creating connections, having chit-chats on the corridor, and speaking up in meetings, gets promoted. And you who is doing all of the work and sitting quiet and saying, oh, my work would speak for me, you don't get promoted and you get disgruntled. So it's important. Visibility is important. If you're doing great work, open a page, LinkedIn page or Facebook, and you talk about it. This is what I've learned. This is what I'm doing. This is what I advocate for. Just share your knowledge. Or if you're training like the younger generation or anything of that sort, talk about it. Don't be shy. Practice public speaking. Attend conferences, talk to people. So it's important. Visibility is really important in this stage because people would also want to see a track record or evidence of what you've said that you can do. You get it? Because the next thing, like you see now in CVs, people ask you to put your LinkedIn page or your website as part of the intro after your name, your phone number, and your email. They say, okay, you can include the LinkedIn page or your website if you have it. Some people will go to it. Some people will go to check, like, okay, what's this person about? What have they been doing? What do they write about? Do they write like someone who knows what they're doing? And what they're doing, is it relevant? Does it tie with what they're saying? Imagine you're applying for this, you're a great doctor, and you're doing all of these great things, and you've applied for this scholarship, and they go maybe to your Facebook or Instagram page, and all they see are maybe party pictures and all of those things. I'm not saying do not post your social life online, but it just depends on what do you want to project. You can project different aspects of your personalities on different platforms. But if you want to progress professionally, choose one of your platforms that you're going to dedicate to showcase your professional expertise and your technical know-how. So that when you want to provide evidence or you want to show like your portfolio of what you can do or what you have done, you're able to give just by a link to say, okay, go here and you'll be able to see what I'm doing. So that's important. Visibility is really important in the aspect of luck as well.
Yeah. That's so true. And I think I remember, when you started your journey of content creation as a medical doctor, I think that was such a big step, really talking to, people about health and trying to improve the outcomes for people in health in Cameroon and all of that. I think definitely that was such a big step. And I think definitely it, of course, helped your journey.
Absolutely. Not only was I sharing information, it really helped also my public speaking skills, and also helped my ability to think in a structured way, because for you to be able to give bites of information in a way that a lay audience understands and you're able to pass across your message, maybe in a 1 minute, 2 minute video, it helped me to be able to synthesize the knowledge that I have and to be able to communicate one idea in the shortest time possible in the most comprehensible way. And, in you trying to break down the medical information, it makes you to even understand some medical aspects. Because there was a time I had to talk about, I think, what causes diabetes. I knew it medically, but then I had to break it down to give an analogy. So, for example, consider your body like a big house and the cells have many rooms and all of that. It helped me to actually understand diabetes pathophysiology better than the way I understood it in medical school. So in doing all of these things, it helped me in my public speaking, my communication, and also being able to think. And it's really, it's evident in the work I do now. People compliment me that, you're able to think in a, structured way and able to communicate clearly. And I would say it's that content creation and putting myself out there that actually helped to build on those soft skills. And it's really important for professionals that want to grow professionally because the technical skills, everybody can learn it. You can go to school, you learn how to code. Now with AI, I can learn anything I want to do. You can learn how to code. You can go to medical school and learn how to be a doctor, how to operate and everything. But the soft skills, which is what helps in the marketplace, not just to make you grow, but to be able to make them to form connections, to be able to connect with the people you serve, like customer service, to be able to even for example, conflict management, negotiation, communication, critical thinking. Those are not things that they teach you. Those are skills that even if they teach you, you need to build it by experience. And therefore, if you're doing all of these things, putting yourself out there, building your visibility, you're also able to build those soft skills in the workplace that can become really advantageous and become your unique value proposition in the workplace.
A few days ago, we celebrated International Women's Day, which was great. You're a woman, a professional, a female professional in the workplace. I know that comes, of course, with a lot of barriers, a lot of challenges. But in terms of your personal journey, how have you seen that manifest, and what are some tips that you would give to, of course, female or other female professionals on how to navigate the workplace and how they can excel as well, even while, facing all these barriers?
And so really, those structural challenges exist. As much as we want to try to dampen it down, people say it doesn't exist. Women are just being noisy and all of that. They exist. There are a lot of studies to back that. The payment, the income gap, even for the same role and everything. Yeah. And then you have all of these other life events that contributes to it. Maternity leave, breastfeeding, children, family, and all of that. We see that in most maybe cultural or traditions, women are usually the ones to make all of those shifts to ensure that the home front is stable. And then combining that with the career really presents those challenges. But one thing I would usually tell my female colleagues or friends is, that's the situation we find ourselves in. So we have to do what we have to do until we get to where we do what we want to do. You get? Yeah. We would have loved to be in an ideal world, right? Where all women are petted, they can take menstrual leave, menstrual cycle leave every 3 days, every month. We want to have 1 year maternity leave or 2 years maternity leave. We would love that world. And I think people are pushing for that. But in the meantime, while we haven't reached there, we have to learn to be able to face those challenges and to be able to thrive through those challenges. But then we as women have to push extra to be able to build that relevance and that value so that when you speak, people are able to look at you beyond just your gender. And then secondly, it's important to build, again, back to the soft skills, to be able to play the game, if I will call it like that. You have to build the soft skills, because if you see, there's a difference between how men negotiate and how women negotiate. First, you see in most cases, men know what they want. Like I was reading our LinkedIn post and they said there was a study that was done. They realized that in the past, I think, was it GRE, was it SAT? There was an exam that used to be negative marking, right? And they did an experiment, or they did an analysis and realized that most women actually, when they weren't sure of an answer, they skipped it without answering that question. But most men took a chance and ticked an answer, even if it turned out to be wrong. So women looked at that negative marking like the cost was too high for them to invest or for them to be wrong. But men took the chance anyways and said, okay, I'll take anyone, irrespective of whether it's wrong or correct, just to tell you that men are more risk tolerant. They are able to take decisions when they're even unsure. And in some cases, those decisions are what push them, propel them faster. And also the fact that they're able to take risk makes them more confident. Like you can see a guy, he knows absolutely nothing about what he's saying. But the way he says it, you think that he knows what he's talking about. But you see a woman who start up with like, sorry, I'm not really experienced in this field, and I always thought, why are you sorry? Just say what you want to say. We women would like to be cautious and, cordial, not to be looked as being rude and all of that, or being direct, or in this case, being masculine, as they call it these days, masculinity and femininity, which I don't understand what it's all about. But then we women have to build the soft skills that enables us to be able to play the game effectively. Negotiation, risk-taking with limited data. Even when you're not sure, be able to take risk with limited data. You're able to form proper connections with people beyond just, beyond just what you want to gain from them, but genuine connections with people that you can, build over time. And then also be able to learn from how men operate. Learn from how they interact with people, how they go on decision-making tables, how they put their points on the table, how they talk, how they even walk into rooms. You get it? Even when you see men, the way they walk, shoulders high, eyes glancing through the room and everything. But you see women maybe go into the room trying to be like feminine, as they say. I don't know why I have a problem with this femininity. But then you see women go into the room trying to be, soft and everything, trying to smile, be friendly with everybody. But men will not usually prioritize that. They want to be seen, they want to be heard, they want to lay the points on the table as clearly as possible, tell you that this is what we want, let us negotiate. And I think women should be able to build those soft skills as they go into the workplace to play the game. Because the game is the game. The game is already rigged against you as it stands now. So you have to multiply, or you have to properly use the tools that you have available to be able to scale through. Of course, again, I say, while we are on the way to fixing it, because people may perceive this as me advocating for things to stay the way they are. No, not at all. So I'm just saying, in the meantime, while we aim for that, when all of these structural challenges are over, we need to build to be able to play the game as it is now.
For sure, you have to play the game the way it is at the moment, even while advocating for the rules to change for the better.
Absolutely.
And I think when I talk to a lot of young professionals, right? We live in a world where everything, it's fast. Everybody wants things to go much faster.
Yeah.
And I know you're someone who, in terms of your career, you've been able to move pretty fast. In terms of moving from one step to the next. So what are some tips, secrets that a young person who is starting out should be looking at to make sure that they can be able to also move not just fast, but also from one step to the next, and climb the ladder a bit more in a way that they are not spending too much time at one level?
Okay, so the first thing I would say is this career acceleration or progression, it's individual. You get it? Everybody should be able to define what career progression is to them. For some people, it could be changing the ranks from manager to director to vice president to president. But for other people, it could be exploring new challenges, even if it's at the same level. So the first thing I want to say is this career acceleration is really individual. But if I am to talk about career acceleration the way most people in formal careers will look at it, which is like moving from one rank to the other vertically, I would say there are three things that I've seen that differentiates people that really move faster up the ranks than those who literally struggle. And the first thing is people who are able to interact across disciplines. That means you're able to have more like a T in skills than an I. That means you don't just go focus on one particular thing deeply and then you know nothing about anything else. You get it? And especially in health, that's really important in health because then most things in the world now are interconnected. You'll be so surprised, something as health, you'll find yourself working with the Ministry of Transport for emergency medical services. I worked in Uganda with the Ministry of Transport because in most cases when there's an accident, the first responder at the side of the scene is the traffic controller who was controlling traffic. That's the first person. And you have to teach the person first aid skills to be able to save that person before they get to the hospital. So I can talk about health because that's what I'm experiencing. But most things nowadays are interconnected. And therefore, when I see people who are able to interact across those different disciplines, that means you could have a specialty. But then if you talk about other things that have either a direct or indirect impact on the field that you are in, you're able to say something, you're more likely to go faster. Because then people are able to see, you're able to see the big picture and see how different things connect to that particular goal. And you're able to, you can envisage risk earlier and be able to develop mitigation strategy earlier. You get. So first, people who are able to think across disciplines like that or across different subjects in a way that it can lead towards a particular goal, they're more likely to go faster. So it's not saying that you go take different courses in the hospital, in the university. No, I'm just saying once you know about your course, if you're a journalist, you know about communication and all of this, but you should be able to also know something about, okay, maybe health communication, or maybe engineering communication or something, but just be able to know something across fields that contribute. And then the second is people who are able to get their hands dirty early enough in the career. Like I wrote a LinkedIn post at some point about like different stages of your career, and people who don't prioritize for stability early, because there's a temptation that you leave university, or I'm looking for a stable job where I can have a stable income. Of course, that's important. But I would say that you should optimize for where you can get your hands dirty. Do the real work on the ground. Build the skills that you need to build early enough, so that as you progress, you'll be able to say, I have done this thing, been there, done that. And this is what my experience has taught me. When you're negotiating on the table, you're not seeing it abstract from some book or from what you studied in the university. You're talking out of real experience. So those second group of people who get their hands dirty early enough, not seeking stability or not seeking like a AC office or anything of that sort, it's important that you get your hands dirty early enough and do the real work that requires you to build the valuable skills that you need, especially when you see like trends in your industry and say, okay, where is my industry going? What can I optimize for? And where can I build those skills that will be needed in the future? And then the third group of people that really accelerate faster are people who I would say, after building those skills, not optimizing for stability and getting their hands dirty, they are able to package that skill and sell it to either customers, if you're doing entrepreneurship, maybe a consulting business, or you package it and sell it to an employer, for example. Because if you have a certain amount of skills and people don't understand how valuable it is to them, you can have all of these amazing skills. For example, you can do video editing, you can do shooting and all of that. But then you want to pitch yourself to maybe a production company. There's a way that you package it, let the company know that, okay, this is what this company is aiming for, and this is how I can help them achieve that aim. So again, back to the issue of visibility. It's in talking, researching, and, communicating with people that you start building what is necessary. Start building like, how can I package these skills or this value that I have and sell it to the world in a way that I can be rewarded, financially or otherwise, the way you want it. So I'll say those are the three people I see that usually progress faster in the career. And you see that when you package it well, you become highly wanted across the world. So you see people who are really highly wanted, changing jobs every 2, 3 years, 4 years, and all of that. And that's just because they've learned how to sell themselves well.
Getting your hands dirty is especially relevant, especially for the medical field where you have a lot of experience. Getting those skills early enough so that you can be able to be a great clinician or practitioner in the medical space. I think that's very, very important.
Yeah. And totally. Even now when I sit in rooms and they're talking about, patient care, especially when we talk about all this digital and AI, and people are talking, how do we put AI in health? And they give it all of these great ideas and all of that. And I'm like, okay, it depends on what you're talking about. Because if you bring that to maybe Cameroon that I know very well, this may not work because of 1, 2, 3, 4. You get, first, there's a trust aspect. If you bring it maybe to America, where they are more developed and patients are comfortable consulting a doctor online, telemedicine, it's good. But for a place where people are more traditional and they want to actually see a doctor touch them, there are patients who have come to the hospital and maybe they just want a test, or maybe they just have something that they want to ask, and they'll leave asking, doctor, you will not touch me, you will not check my heart. They still want to feel that care, that they got that care from a doctor, and the doctor told them that everything is fine, that assurance from a doctor after checking them. So in that case, I'll tell them, okay, if it's in that kind of society, just saying that telemedicine and all of that may not actually lead to a patient who is, patients will not be satisfied that they have seen the doctor because they still want that touch. So it's important that when you get your hands dirty, you're able to sit in those rooms, decision-making rooms, and be able to bring real-life experience and be like the mouth of the end users in those rooms.
And you touched on something which I've been thinking about quite a lot, especially for the medical field, because of course you mentioned out there that we're talking about AI, all of this technology. doing surgery remotely, things like that. But in the developing world context, do you really see AI basically replacing doctors, replacing nurses in the near future?
Replacing is very extreme, I would say. But there's a place for AI in healthcare, definitely. And for us to be able to optimize the potential of AI in healthcare, of course, there must be a foundation, and that foundation is in infrastructure. So even when we talk about AI in Africa, I say AI is like, how do I put it? It's like icing on a cake. For you to put icing, there need to be a cake. You understand?
Yeah.
And that cake is the foundational things. Internet, like we were just before now, we were struggling with internet and all of that. The internet, the electricity, even the mobile phones and all of that. We have all of this AI cloud infrastructure and all of that. Optic cables, you can name them. So that infrastructure, do we have what it is to build on? Like for now, we still have our digital health records. We still have our health records on paper. Yeah. AI wouldn't analyze data on paper. So it means we need somebody to transcribe that data from paper to electronic health records. And then now we can integrate AI to help us analyze that data. But we're still far from there. If we're talking like Cameroon, for example, we're still far from there because we still have our records on paper. And therefore, how do we use AI for paper records? You understand? So when we talk AI, we should be able to ground it in the reality that we are operating in. We should not just talk about AI because it's a trend and everybody is following it, and therefore we should follow it. It's important that we choose our battles to understand this AI. Is this where we are now? Because seriously, if you digitalize rubbish, you will get rubbish. You understand? Yeah. Because, for example, you don't have standard workflows. You don't have standard patient journeys. You don't have interoperability between hospitals. Like a patient can go to 4 hospitals in a year and have 4 different records. And maybe they don't even have access because some hospitals keep their records with them and the patient doesn't even know what is in it. You understand? Now, if you want to digitalize that workflow, how does it work when it's not even standardized? You understand? Hospitals don't even communicate with each other. And then not to talk about the public sector and the private sector that are operating really differently. So it's important that when we talk about AI, let's analyze and understand that as much as there's potential, some countries are way ahead. Let's look at it from within the context we are operating in. What do we need to catch up to ensure that this AI, we don't miss out? If we're talking about fear of missing out, like FOMO, that, this AI is coming, we're going to miss out on it. You may just go in and adopt AI for things that it doesn't work. There are processes in healthcare that can be optimized by AI. Like, for example, now you're having radiology images being interpreted by AI. And even in all of that, you still need quality control. Because as you know, AI hallucinates. Of course, it's developing. But this is healthcare. A mistake and somebody dies. It's not like manufacturing, where, for example, you're manufacturing biscuits and a robot makes a mistake and doesn't seal one end. You just bring it back and it seals it. But for example, if somebody makes a mistake, you do a wrong diagnosis, somebody literally dies. You lose either somebody's child, somebody's wife, somebody's brother, sister. That's a whole life that is gone. So in all of this, we cannot say it can replace health professionals because you would always need that quality control by a human who understands the context of the patient, because AI will interpret just based on what you give it. But the doctor understands the context of the patient, is seeing the patient physically, and is able to have additional information or additional interpretation of what they see that the AI may not be seeing. So in whatever case, you still need doctors, nurses to be able to do that quality control for the output of AI in healthcare.
And of course, doctors are such a big part of the medical space. Yourself, you're a doctor, but I think especially in the developing world where we live in, we have a bit of a crisis of doctors. Not only are doctors not well appreciated, I would say, but in terms of even financial remuneration, things like that, it makes the environment very difficult for doctors. I'm not a doctor myself, but I've spoken to enough doctors to understand that it's quite a difficult environment. And you see, this forces a lot of doctors to go into entrepreneurship and for themselves, and start stressing a lot, trying to do small things here and there, sometimes ethical, sometimes unethical, to try to make ends meet and keep themselves. So what has been your experience around that, and in terms of how this can be improved, how doctors can be better treated in terms of financial remuneration, in terms of the conditions of work? What do you think? How to improve on such a difficult situation?
It is really difficult and also difficult to solve.
Yeah.
And I will say this is not just in Cameroon. Having worked in health systems across the world, human resources for health is a global issue, and it would differ depending on which health system you're talking about. For some health systems, they're not enough. For some systems, they're enough, but they don't have positions for them. In some systems, they are enough, they have the positions, but the doctors feel like they don't have the equipment to be able to fully optimize their knowledge or deliver the service that they want to deliver. So in whatever case, there are different dimensions of that problem. But talking about Cameroon, where I would say it's more or less there are doctors, but there are no positions. I think there are more than enough doctors. And we also have, if we look at it like global index, like doctor to patient ratio, we may think doctors are not enough because you have a number of, you have a number of doctors for a number of patients, but doctors are being graduated every year. And if you ask some doctors, they don't have jobs. I've had friends having to ask, are there people you can connect me to have a clinic where I can just be passing time or doing an internship and all of that. So there are actually doctors in Cameroon that are not employed. So when people talk about, the difficult conditions of doctor, it stems first from a budget issue. As you would know, the government is the highest employer of doctors in public hospitals. Cameroon's health budget is not as much, and therefore most of that budget goes for salaries and all of that. So there's just enough people that they can hire. And for if you want to hire so many people, spreading that small budget across all of them, I mean, the per unit salary is going to be really low. I mean, I earned like $500 per month as a doctor, and I was working with one of the private institutions that are considered high paying, So to address that issue, it will stem first from, the budget issue. And then secondly, from really enabling the private sector as well. Not making it hard, like enable the environment for people to be able to have practices. There are so many models that people can use for doctors to have private practices in a legal way, and deliver care. Because if I open a hospital today in Cameroon, I will not be the only doctor consulting there. I can hire 2 or 3 more, or 4. You never know. I'll hire nurses, I'll hire maybe midwives and all of that. So if the government, they see that, we cannot absorb all of these people we're training, but how can we enable the private sector to be able to absorb some of these people? And if the private sector cannot absorb, can we find a way to diversify their roles such that doctors are not just in the hospital? Like, for example, home consultations. We can bring in home consultations into the scene where the government has a scheme saying that, we have this triage system, maybe by telemedicine or by phone call or 911 or whatever it is we want to do, where we see that, if somebody calls and we see that their condition doesn't require them to come into the hospital, can we send a doctor to them instead, Or in some cases, also telemedicine. In some cases, if you see that, in some cities where it's really congested, can we decongest by doing some consultations from home? And then every doctor doesn't need to work in the hospital. You can actually sit in your home and take consultations or do that triage. So diversifying those roles beyond sitting in a hospital or by being employed by a hospital can also help to ensure that doctors are able to use their skills for the benefit of the patients that they serve. It just takes a matter of rethinking how health systems should be. We mustn't stick to the traditional way of every doctor has to work in a hospital. We can always find a way to diversify the roles beyond the clinic and even involve them in other things, public health, in policy, or even in digital health and all of that. And then everybody can be able to use the skills that they gain from school for the benefit of population health.
So just coming back to the issue of education that we were talking about earlier.
Yeah.
You're someone that obviously has a lot of education. You've been through many things in life.
Yeah.
in Cameroon, we have this thing that, for a young person, you would always think that, for you to get an opportunity, you need to know someone, or if you're trying to apply for a job in an organization, you maybe need to have a friend or an uncle or someone that knows someone. I personally think that is not usually the case. For if you're good enough, you can be able to get that. But in your experience, do you agree with that you really need to have someone that can put in a word, or is being good enough?
Being good enough is not enough, as we've been saying. That's not the only thing you need to go further. You always need connections. You need the mentors, you need the sponsors everywhere you go. You need somebody to be able to defend your name if it comes up in the rooms where you're not in. You understand?
Yeah.
In some cases, I have defended the names of people based on what I know about them. And in some cases, in fact, I can't even say I've come this far out of what I know. There are people who know way more than I do. You get it? But it's because I was able to stand on the shoulders of giants who permitted me that I'm able to go further, I'm able to see further. There are people who have called my names. There are people who have put my names in things. For example, I had one program I can't remember the name, but it was a public speaking training in Kenya, where it's just one of my Facebook friends who had participated in that before, who sent me a Facebook message and said that, hey, this opportunity, I'm an alumni, and I think it really be great for you, especially for your content creation. Just apply and put my name as the recommender. And I was able to get the opportunity. And that goes back to the visibility I talked about. So you need the connections, the mentorships. You need the visibility for people to be able to see. Because if people don't see you, they can't talk about you. I can't vouch for you if I don't know what you do or what you're capable of doing. You understand? Yeah. So beyond knowing what you can do is, what do I say? I'll say knowing what you can do is the package. Then those other things is what you have as the packaging. You understand?
Yeah.
The packaging, when you pick up a book, that sometimes you buy a book just because the front cover looks really interesting, looks really nice. Or you pick up a package and you see that the way they packaged it is really nice. So you looking maybe well-dressed, having the right connections, the visibility and all of that is the packaging and everything. But then now you should build that technical know-how, because then when they open that packaging, they should be able to still see something valuable and not realize that all of this was fluff. Because then many people will say, who you know gets you in the door, but what you know will keep you in the room, right? Because people are able to see fluff and just dispose of it. You get it? Yeah. So while you build the technical expertise, you have to build that external package, or you have to build what is it that will get you to the room, and then that technical know-how is what will keep you in the room. Yeah, so definitely knowing what you know is not enough. There are just other things that you have to do, especially in this competitive world and job market that we find ourselves in.
We discussed briefly about something which is, I think, I hold very dear to my heart, about excellence. Doing things properly, doing things the right way. I think that is becoming more and more the norm. But in our environment, you have people who maybe that is not so much cherished. For example, you have people that do the bare minimum, promote a lot of mediocrity in the way things are done. You have a lot of local experience. You also have global experience at that level. If you were to give someone advice on, excellence, mediocrity, and, how they can position themselves, what would that advice be?
It just be that, be excellent at what you do. And again, it goes back to, what are the incentives for being excellent? What are the incentives for excellence? If you live in a place or in a society where excellence is not rewarded, you will not strive to be excellent, because you're like, what's the point? But then it depends now on who is looking at it. If you're somebody who is building for global, one thing I would tell people is, beyond Cameroon, there are countries, there are audiences that value excellence. And therefore, if you're aiming to go beyond Cameroon, you should strive for excellence. Excellence is not perfection. You understand? Excellence is just doing it to the best of your ability and also finding ways to improve it beyond the way it is. Because you can do something to a very mediocre level, you think that's the best. But look at it, compare it like if somebody maybe of my level in maybe somewhere like in America or somewhere else, like whatever you're using as your comparator for excellence was to do this thing, would they just end here? You understand? If you're doing a paper, for example, you want to publish a paper and you've written it so well and everything, but you realize that all their mistakes or their grammatical errors and all of that, you're just like, no, leave it. The editor is going to do that or they're going to figure out what I'm talking about. But you look at it and say, but what are the other papers that are being submitted? How do they look like? Have you seen a grammatical error? No. So you take your time and you correct those errors to ensure even something as much as spacing and, alignment to ensure your text aligns and all of that. It's a way to just make this thing presentable in a way that somebody reading it can show that some attention was put into this. Some attention to detail was put into it. You understand? And being in Cameroon is very easy to excel when you are excellent or when you put in some effort to be excellent. Because then some people say the bar is on the ground. The bar is even below the ground. The bar for, for excellence is on the ground. And so the least effort you put, like we go, for example, customer service is so bad. You go to restaurants, hotels, or the customer service is bad. Imagine opening a business that all you do is that you just have someone by the door. As customers come in, you just greet them. It's like a very basic thing, but you've changed the entire landscape of your income or customer base just by doing that one little thing because it's not very evident in other businesses. Yeah. So it's just a matter of advising people that put in some extra effort beyond the average. Yeah. Just put in extra effort beyond the average to be able to get a level ahead or a step ahead of what your peers or what your competitors are doing. And then it's going to take you far. And I'm still saying excellence is not perfection. It mustn't that you must know everything or everything must be perfectly done. But excellence is knowing that you want to be able to be one step above the average or what is currently being done, irrespective of the incentives. It's about you and where you're going. If you see that where you're going to requires you to be excellent or for you to put in that extra effort, then you should put it and not just by limited by the incentives in your environment.
Thank you.
Yeah.
Thank you so much, Dr. Ngwashi Christabel. I think it's been such a pleasure having you and your advice. I think a lot of our audience will be able to follow the show, listen to you, and be able to see how they can emulate this journey. Thank you so much for coming.
Yeah. Well, my idea is not for you to emulate my journey, but my idea is for you to be able to take some lessons or tips from my journey and to be able to better yours, not just for you to be as exactly as me, but for you to be able to define what success is to you, to define where you want to go to, and using these tips to be able to ensure that journey is enjoyable, fulfilling to you, and you're able to achieve the goals that you've set out for yourself. Yeah.
Great. Thank you very much.
Thank you. It was such a pleasure having me. It was a great conversation.
Thank you for joining me on this episode of the BIIG Africa Podcast. Please tell me your thoughts in the comments and provide suggestions on how we can keep improving the show. And I promise to bring you even more insightful guests in our next episodes. Thank you and bye-bye.